Understanding skin cancer, prevention, detection and treatment. Hello and welcome to our skin cancer video. Skin cancer is one of the most common diseases in the world and can be a serious threat to health if it is not detected and treated in time. The purpose of this video is to provide information about the prevention, detection and treatment of skin cancer, as well as to help clarify some common doubts about this condition. We will see how to protect the skin from sun damage, how to detect the first signs of skin cancer, and what are the treatment options available. We will also address the role of prevention in the fight against skin cancer and what needs to be done to keep skin healthy and safe. This video is intended for anyone interested in learning more about skin cancer and how to protect their health. So sit comfortably and let's get started. Skin cancer is a disease where skin cells begin to grow uncontrollably. It is one of the most common types of cancer and affects people of all ages, races, and skin types. There are several types of skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma. Melanoma is the most deadly type of skin cancer and is caused by exposure to UV rays from the sun or UV lamps. It is important to be careful with sun exposure and use broad-spectrum sunscreen to protect the skin from damage caused by UV rays. In addition, it is important to regularly check the skin for signs of changes, such as dark or swollen spots, or changes in the appearance of an existing mole. Basal cell carcinoma is the most common type of skin cancer and usually appears as a red, scaly, or rough lesion on the skin. It is caused by prolonged exposure to the sun's UV rays and can be easily treated if diagnosed early. Squamous cell carcinoma is another common type of skin cancer and appears as an elevated skin lesion. Like basal cell carcinoma, it is caused by prolonged exposure to UV rays from the sun and can be successfully treated if diagnosed early. To prevent skin cancer, it is important to take measures to protect yourself from exposure to UV rays from the sun, such as wearing sunscreen, wearing clothes that cover your skin, and avoiding exposure to the sun during the hottest hours of the day. In addition, it is important to carry out regular skin checks to detect any early changes and treat any skin health problems as early as possible. If you suspect you have skin cancer, it is important to immediately seek a doctor or a skin health specialist to get an accurate diagnosis and start treatment as soon as possible. Treatment for skin cancer may include surgery, radiation therapy, light therapy, or chemotherapy, depending on the type and severity of the disease. EMO's homeopathic remedies can help stimulate the system. Summary: skin cancer is a serious disease. Verification of skin cancer. Regular checking of the skin is important to detect skin cancer early. It is recommended to perform a monthly skin self-examination, examining all areas exposed to the sun, including the face, neck, arms, hands, legs and trunk. In addition, it is important to consult a doctor or a skin health specialist every year for a complete skin assessment. During skin self-examination, it is important to look for signs of changes in the appearance of a mole or skin injury, including single color or uneven spots, inconsistent size or shape, changes in skin texture, such as swelling or flaking, bleeding, itching, or pain, rapid growth or changes in appearance. If you find any changes in the skin, It is important to immediately seek a doctor or a skin health specialist to assess the lesion and carry out appropriate treatment if necessary. Examination of skin cancer. If a sign of skin cancer is found during skin self-examination or during consultation with a doctor, it is important to conduct a full skin examination. The examination may include the following. Physical examination. The doctor will examine the lesion or mole and check for signs of changes in color, size, or shape. Biopsy. If your doctor suspects skin cancer, you can do a biopsy by taking a sample of the lesion under a microscope. Dermatoscopic examination. This examination uses a special device to examine the lesion under an increased light, allowing the doctor to see details of the skin structure that are not visible to the naked eye. The test result will determine whether treatment for skin cancer is needed and what type of treatment is best for the specific case. Skin cancer and homeopathy. Homeopathy is an alternative form of treatment, but after all, what is homeopathy? Homeopathy is an alternative medicine practice that is based on the idea that diseases can be treated with highly diluted substances that, in concentrated doses, would cause the symptoms of the disease in question. Homeopathy was created in the late 18th century by the German physician Samuel Hahnemann and has been widely used in many countries since then. Homeopathic remedies are made from substances such as plants, minerals, and animals and are diluted in several stages so that the final amount of active substance is minimal. Homeopathy is based on the idea that water memory or the